Heat and mental health megs. Stay safe this summer. Adderall, Lexapro, and more. Heat can turn even the calmest minds into vulnerable ones, especially for those on mental health medication. As summer temperatures soar, it's a delicate balance between enjoying the warmth and avoiding heat exhaustion, especially for folks taking certain drugs. With the heat index hitting 100 degrees Fahrenheit on July 24th, the National Weather Service warns that Southeast Michigan will face extreme heat, potentially triggering heat illness due to high humidity. While extreme heat poses risks to everyone, those on specific mental health medications may face heightened dangers. This isn't just about discomfort, it's about safety. Experts explain how different medications interact with the body's temperature regulation. For instance, stimulants like Adderall and Concerta boost dopamine, which affects focus and decision-making. But they can also create a sensitivity to heat. Kristen Ward, a University of Michigan pharmacist, notes that dopamine in the brain, particularly in the frontal lobe, is crucial for executive functioning. When the heat strains this system, people may struggle to stay alert or manage emotions, leading to confusion or impaired judgment. Newer antidepressants, like Lexapro or Prozac, work by altering serotonin levels, a neurotransmitter linked to mood and energy. However, they can cause anticholinergic side effects, making the body less able to sweat. Vicki Ellingrod, a University of Michigan pharmacy dean, explains that this can lead to excessive sweating, which is vital for cooling down. Without proper sweat, the body becomes more prone to overheating. Older antidepressants, such as tofranil or norpinephrine, block acetylcholine, a chemical messenger in the parasympathetic nervous system. This blocks the body's natural cooling mechanism, making people more sensitive to heat. Antipsychotics also play a role, as they can disrupt the hypothalamus, the brain's temperature control center. When this happens, individuals may not sense heat as clearly, risking overheating. The takeaway? Stay hydrated, avoid prolonged sun exposure, and keep fans handy. But here's where it gets controversial. Some experts argue that these meds are just as effective as others, but the risk of heat-related complications is real. And this is the part most people miss. How simple actions like wearing light clothing or taking breaks in shaded areas can make a world of difference. If you're on medication, know your limits. If you're unsure, always consult a pharmacist. After all, in this heat, your health matters. Let's take care of ourselves and each other, with care and curiosity. Stay safe using medicines and devices in summer heat. Essential guidance for safely using medications and medical devices in the summer heat. As the summer sun blazes down, it's crucial for patients, families, and vacationers to understand how to keep their medications and medical devices effective while traveling or enjoying the warm weather in the UK. The Medicines and Healthcare Products Regulatory Agency, MHRA, emphasizes the importance of this awareness. With soaring temperatures both at home and abroad, it's vital to recognize that heat can significantly impact the integrity of medicines and medical devices. But here's where it gets controversial. Many people underestimate the effects of heat on their health essentials, which can lead to serious consequences. To ensure safety, the MHRA strongly advises against leaving medications in direct sunlight, inside hot vehicles, in travel bags, or on sunlit windowsills. The agency warns that heat can easily surpass safe storage temperatures, leading to the degradation of various products, including tablets, inhalers, insulin, and EpiPens. Pro tip: when traveling, it's best to store your medications in a cool bag to maintain their effectiveness. Patients should also be cautious with blood glucose monitors, as excessive heat or humidity can lead to inaccurate readings. This is particularly important for those managing diabetes, as incorrect readings can have serious health implications. Moreover, certain medications, such as diuretics, blood pressure medications, diabetes treatments, antipsychotics, and stimulants, can exacerbate dehydration. Individuals on diuretics should be especially vigilant about dehydration risks and her symptoms very well yet. Additionally, certain chemicals such as methotrexate, diuretic, blood pressure medications, diabetes treatments, antipsychotics, and stimulants can take health implications. The MHRA also issues a foul thing on her licenses. Medications can prolong shrinkering through too much heat, complexity alteration. Interested lovers hanging of a analog hay fever injections. While EP injections are approved for other medical conditions, they are not licensed for treating hay fever. The agency states that the potential benefits of using this treatment for hay fever do not outweigh the associated risks. For those with pacemakers, it's essential to carry your implant identification card when passing through airport security and to inform the staff about your device. According to NHS guidelines, airport security systems typically do not interfere with pacemakers, but it's wise to be prepared. If required to pass through a scanner, do so quickly and avoid lingering nearby. Handheld metal detectors should never be positioned directly over a pacemaker. Final thoughts. Dr. Alison Cave, the Chief Safety Officer at the MHRA, highlights the importance of these summer safety tips. She notes, as the sun shines and temperatures rise, it's easy to overlook how heat can affect our medications and devices, as well as how some treatments can alter our reactions to heat and sunlight. These updated summer guidelines are crucial for ensuring that everyone remains safe and healthy during the warmer months. What are your thoughts on the impact of heat on medications? Have you ever experienced issues while traveling with your medications? Share your experiences in the comments below.